Welcome back to part 2 of the Introduction to Clinical Governance lecture. So here we're going to have a look at two of the pillars of clinical governance, and those are going to be patient and public involvement and clinical audit. We're going to look at these in a bit more detail, basically relating to community pharmacy, but it could be extrapolated out with some of the actions to hospital pharmacy and other varieties of pharmacists just working in GP practices, but this is specifically looking at the community pharmacy contract relating to clinical governance. So first, thinking about patient and public involvement, and going back to what I said earlier, why should we involve patients and the public? And that's basically because they're our customers, and whether this is the NHS or private services, if the patients aren't happy, then we're not doing it right. So we really need to listen to them. And what also we need to listen to is when they've got some really good comments about what we've done, saying that we're doing a great job, because if we're doing a great job, then we need to spread that practice elsewhere. So it's very important to listen to patients. And there's several ways in which we can do this. So listening to patients, probably the easiest way is through our annual patient satisfaction survey, which is one of the things that we have to do as part of our contract. And patients can then help us in service improvement and the redesign of what we're doing. And I'll go into the details of that in a moment. We also need to listen to their complaints. As I said, from the mid-staff's inquiry at that hospital, they didn't listen to the complaints of patients. And it took a really long time through a great number of complaints and then horrendous problems with a lot of unnecessary deaths at the hospital to realise that something was going very wrong. So listening to every single complaint that comes through is really important, and that's one of the parts of clinical governance. And also thinking about errors, so when mistakes happen, having a very good system in place to deal with each one of those errors and make sure that you act on it and try to prevent it from happening again. So we also have to cooperate with inspections and reviews from NHS England. So NHS England inspect our pharmacies as well as the GPHC, because they're our commissioners. They commission the services from us. They have a series of inspectors who go around, but mostly the inspections that we have are done, it's self-inspection, so you have to fill in huge masses of documents every year, and this is a self-inspection regime, and it helps you to see all the different things that you need to do and the things that you've missed. As well as that, patients can contact NHS England directly and complain to them, and it's very usual practice for hospitals when they find out that there's a dispensing error, for instance, which has occurred in a community pharmacy by looking at the medicines that a patient brings in. They will contact NHS England routinely, and NHS England will then contact that community pharmacy company, and you'll have to go through a series of steps to ensure that that mistake doesn't happen again. So it's cooperating with those bodies to make sure that we do the right thing. Now, from patient groups meet up and they sort of identify areas of weakness or areas that are really annoying to patients, or some things that patients are not satisfied with from community pharmacies. And one of the things that's always identified is that community pharmacies don't stock the right things, and they have to keep going back, and there are lots of things that are owed to them. So this is one of the things that we have to look at, and it's been identified from patient groups that we need to improve our service and provide a better quality service just by stocking the right items. So we do need to monitor the stock that we keep and look at medicines owed and do audits on that. We also have to make reasonable adjustments in line with the Equality Act, and what this means, this is about patients who are disabled. So the Equality Act means that everybody should be able to access the same services as much as possible. And so for disabled patients, we have to make reasonable adjustments to our premises to allow them to access services. And this is putting ramps into your pharmacy if possible, instead of steps going up to the door. It's about having the right equipment so that disabled people can get in, and that they can also, say if somebody's partially sighted, just having something like a a magnifying glass so that they can see the prescription that they're going to sign. All those kinds of changes, having the right access arrangements so that disabled people in a wheelchair can get into the consultation room, that has to be in place, and those are your reasonable adjustments. And this is part of clinical governance, thinking about patients and the public. And we also have to be able to communicate with patients well so that they can access our services, and we have to display a practice leaflet. Every pharmacy has to have one, and we'll go into that in a bit. And you also have to notify the public about your services, and this is through a poster or a website, usually these days through having your NHS data on the nhs.uk website. So this is just to show you the details that you have to have on your practice leaflet, which every pharmacy must have. And you don't have to learn all of these details. It's each pharmacy company would have their own logo on the leaflet, but these details have to be on there as part of your contractual arrangements. And so you have to have your phone number, which is a really good detail to have, so you can give these to patients and then they can contact you much more easily. And there's all sorts of other details, opening hours, all these things are important so that members of the public know when you're open and can access your services. They also need to know what to do when your pharmacy is closed. So here, when the pharmacy is closed, contacting NHS 111. So all these things are important, and this is the NHS requirements. They require us to write all these things in our leaflets, and we can put a few other things in as well, but it's a pretty fixed leaflet. But every pharmacies look very different because they've got their own logos on them. So the Community Pharmacy Patient Questionnaire. So this is the annual questionnaire that we have to do for patients. GP surgeries also have to do the same. Hospitals are also required to do surveys of their patients to find out whether their patients are satisfied with their service. And these questionnaires are very detailed. Again, it's set questions by the NHS. So we can't ask what we like, we have to ask what the NHS tells us to. And if you look at question 4, it's really tiny wording, but I can just about reading. It says, thinking about any previous visits as well as today's, so this is when patients come into your pharmacy, how would you rate the pharmacy on the following factors? And the first one there is the cleanliness of the pharmacy. So this is very personal because your levels of cleanliness might not be how the patients perceive it. So this is really thinking about how your pharmacy comes across to the public. And then the question 5 underneath, again, is actually thinking about the pharmacist and other staff who work there. And so it's looking at whether the staff are polite and they take the time to answer your questions, whether they're knowledgeable, and whether the service that you received from the pharmacy staff was good enough, the service you received from the pharmacist. So these are very personal questions, and it's very enlightening to see what the public think of you and your pharmacy. So it comes down to the individuals as well. So this is a very useful questionnaire because it allows you to see whether your pharmacy is providing the right sort of service to patients. And in the comments box, that's usually the most interesting bit, where the patients put all sorts of things. In my pharmacy, they always used to put that there wasn't never enough seating because we only had 2 chairs for them to sit on. And it was a pharmacy where we had lots of elderly customers. So that was always a complaint, and we needed a refit, but it never got done. So every year we would get the same complaints about the seating. So that's an important part of what we do with patient and public involvement, because the members of the public will really tell you where your shortfalls are, and you can act upon it if possible, although that issue with the seating was a problem because doing a whole refit might cost you £50,000. Okay, so what do we do with the results of that patient questionnaire? Well, we publish it on the nhs.uk website. So you can see up here we've got the Community Pharmacy Patient Questionnaire over a number of years going back in time, and not only the questionnaire itself, so the answers to the questions are made into graphs which you can then easily see the results of, and you also have to analyse your data, and you have to look at good things that happened and also weaknesses. And you also have to have an action plan as to how you're going to improve in the future, and you have to publish the whole lot of that, and it's all available for any patient to view that. And of course you change what you do depending on that, on the results. So for patient and public involvement, here's a question for you. Have a read and answer it. Okay, well, the correct answer is B. So it's really a self-assessment. It's where you get assessed by members of the public, and then you self-assess what they've written, and what you have to do is to see what you're doing well and what could be done better, and you identify actions to change how you operate as a result, and you make those changes because the public want you to. Okay, so going on to the second pillar, which is clinical audit. So this is a concept which is about improving patient care through monitoring your standards. So we talked about monitoring standards, didn't we, earlier on in part 1. And here what you're going to do is you're going to look at what you're doing already and see whether you're doing a good job by comparing what you're doing to a standard. You're going to learn from it, and if necessary you're going to change your practice. And community pharmacy, the NHS contract ensures that we have to do one, at least, practice-based audit, which is set up by the company, by the pharmacy itself, and then at least one from NHS England, and often there are many, which we have to complete. And so these might be organised for all pharmacies in a geographical area. So NHS England has various local area teams, and it might be a localised audit or it might be a national one produced by NHS England. And in fact the practice-based audits which are organised by the community pharmacy might just be for that one pharmacy, if it's an independent pharmacy set up by that pharmacist, if there is something that they want to look at, or it might be a national audit which all community pharmacies decide to do together to really collect a huge amount of data and get it all analysed at the same time for a particular purpose. So this is just to describe the audit cycle. So basically you're going to decide what you're going to do your audit on, and often you'll look at a point of weakness within your pharmacy, so something that you know isn't being done that well, and you agree standards. So you set the standards for your audit, you design your audit on that, and then you collect data. You analyse your data, and the data collection might only be for a couple of weeks, it might be for 1 week, it might be for up to a month. So it's just a quick snapshot of what's going on compared to your standards. You analyse your data compared to the standards, and you find areas of achievement and areas of non-achievement. So there might be some weaknesses, and that's why you usually pick something that you know isn't being done that well with these audits, to get some decent data which you can then implement changes on and then improve, hopefully, and then you monitor the progress of what's happening, and then you might do the same audit again. So that's why it's a cycle, because you may then repeat the audit to see whether you've improved. So as I said, audits are really about looking at things that you're doing already to see whether you could do them better. It's not just about collecting the data, because you've got to analyse it. It's not lots of work, it's just a quick snapshot. It can actually sometimes be about saving money, but mostly not. Mostly it's not about that. It's about doing a better service. And it's not about blaming people for doing things badly. So you're not really looking for individuals here who are not doing a good job. That isn't an audit. It's about looking at services that you're providing and making sure that you do the best job by identifying areas of weakness and improving. And it's not the same as research, because you're looking at things you're doing already. You're not looking at something new, although it can sort of go into a research category if you do identify new ways to work. So here are some examples. So for practice-based audits, so these are ones identified and dealt with and designed in pharmacies. So see, these are some of the ones that I've done in pharmacies. And this is years ago. Lung cancer awareness audit was designed by the RPS. and I took part in that. That was a very good audit. It was basically training up our staff to, well, firstly we looked at what we did already, which was how often we talk to people, particularly smokers, about lung cancer and people who've got a cough, which lasts a long time. And then it was doing a load of training on the staff, with the staff, and providing a lot of information to patients and seeing what results we got as a result of that. MDS audits, this non-steroidal anti-inflammatory drugs and PPI audit was a national one that all community pharmacies did. It produced a huge amount of data. It was 3 years ago that we did it, maybe 4 years ago, and it's just been published in a scientific journal, all the data from all the community pharmacies. So it took a long time to get all that data together, analyse it, and then produce the results from it with actions. These other audits, this prescriptions for valproate in women of childbearing age audit, this was triggered off because we knew we weren't doing a good job in community pharmacy. We'd had some complaints from patient groups that some pharmacies weren't providing enough information to patients who were on valproate, so that women of childbearing age were not knowing about the risks of taking valproate. It's a medicine which causes birth defects. And so this audit was set up by the Company Chemists Association, which is a group which includes Boots and Lloyds and all the big pharmacies. Day Lewis isn't part of that, but they decided to roll it out to all pharmacies, and we all took part to try and improve the amount of information that we're all giving to patients. So it was a sort of patient safety audit really as well, and produced some very good results because all the community pharmacy companies got involved, and hopefully patients are now all informed about valproate as a result of that audit. So for thinking about NHS England based audits, these, as I say, they can be sort of local area ones or they can be national ones. So the emergency supplies one here was set up by NHS England to look at what sort of emergency supplies we were giving in community pharmacies, and the data from that fed into the development of a new advanced service called CPCS, which is the Community Pharmacist Consultation Service, where community pharmacists do emergency supplies which are forwarded to them from the NHS 111 service. So that provided the right data for NHS England to set up a new service for us. And others are clinical audits, which might be set up locally, they might be national. This Blood in P one was to do with guys who might have prostate cancer or bladder cancer, so just to get them referred back to GPs. So that raised awareness of a particular condition which sort of is not that much highlighted because it's kind of an embarrassing thing for gents to talk about, but you sort of highlight it in your pharmacies and talk to patients about it as part of this audit, as an action from the audit, and then you end up picking up lots of patients and sending them to GP surgeries who may have prostate cancer, which is one of the most common cancers. So audits can be about all sorts of things. They can be clinical, very clinical, or they can be more process driven, but basically what they're all about is raising the quality of the service that we provide in our pharmacies, all part of clinical governance. So here is a question for you about audits, and if you can answer this one, have a quick look. Okay, so I don't know what you've got for an answer in your head, but A and B are really just about collecting data, and there's no suggestion that they're going to analyse the data, so they're not really an audit. But C, D and E could probably be classed as an audit, and probably the best example is D, because you've got analysis of results, implementing a system to encourage GP interventions, and then also this cycle, so you're going to repeat the following year to see whether anything has happened and whether you've got a good result or whether nothing happened and it had no effect.